Hello guys, my name is Anita Luanga. I'm an exercise physiologist, internist, and geriatrician. February is Heart Health Awareness Month in the US and in Canada, and we have been talking about heart disease. In this video, I'm going to talk about how physicians diagnose heart disease. Now, there are several different kinds of heart disease. I mentioned them in the first video that I did this week. But in this video, I'm just going to talk about some of the general tests that a doctor might do to diagnose a specific type of heart disease. The one that we most commonly hear about is coronary artery disease, which can lead to heart attacks. So if somebody comes to their doctor with complaints that are suspicious for some kind of heart disease, their doctor will likely perform an ECG. An ECG is a test where they check the electrical activity of the heart. It can indicate if there are abnormal rhythms affecting the heart, and in some cases, if there is a structural abnormality of the heart, but other tests will be done to confirm this. In addition to an ECG, an individual might get a test called a Holter monitor or an event monitor. The challenge with a Holter monitor is that it only looks at the electrical activity during one point or a few seconds in time. But if this is not enough information, because some people might have symptoms that kind of hide or are a little bit sneaky, they might need tests to look at the electrical activity of their heart for at least 24 hours, and that's a Holter monitor. And then the other monitors can look at the electrical activity for 48 hours, 1 week, or even longer than that. And in that case, another kind of heart condition that was missed on the ECG might be diagnosed. Another test that is commonly done when somebody goes to the hospital or to their doctor with complaints of chest pain or other symptoms associated with heart disease are enzymes from the heart. One of these enzymes is called troponin. This enzyme is often elevated when somebody's having a heart attack or some kind of stress on their heart. Another enzyme that we look for is called BNP, or beta natriuretic peptide. It is often elevated when there is more stress on the heart. Say if somebody has something called heart failure, they have too much fluid for their heart to handle properly, and as a result, this enzyme called BNP can go up. Another test that is often done to look at the structure of the heart is called an echocardiogram. Essentially, this is an ultrasound of the heart. This will tell the doctor about the structure of the heart, say the thickness of the muscles, if the muscles are pumping properly, or if there is a muscle that's not pumping the way it should. It'll tell the patient's doctor about the valves, if the valves are leaking, if they're too narrow. And it can also tell the patient's doctor about the pressure in the lungs, because the heart and the lungs are connected. If there's too much pressure in the lungs, it can put stress on the heart. Another interesting test that is more commonly done now is a CT of the heart. The CT angiogram, or CT of the heart, can look at the blood vessels of the heart and can tell the patient's doctor if the patient has a disease such as coronary artery disease, which leads to a heart attack. Another interesting test is called cardiac MRI. Basically, it's similar to a CT scan, which looks at the structure of the heart in 3 dimensions, but it can also look more at the muscles and tell the patient's doctor if they have another condition such as a cardiomyopathy. In simple terms, it's a disease where the muscles of the heart are affected and the muscles are not pumping properly. Another test, this one is the one that's most commonly used to diagnose a heart attack in an emergency situation and to remove the stuff that might be clogging the blood vessels around the heart, is called a coronary angiogram. This is an invasive procedure where under live x-ray, the cardiologist will look at the blood vessels surrounding the heart. They will see how the blood vessels are functioning, if they're having what we call spasm or just contracting abnormally, and or if there is some kind of substance clogging those blood vessels. In some cases, the cardiologist might clean out those blood vessels, and they can also place a stent to open up those blood vessels in the surrounding the heart and keep it open. There are several other tests that are used to diagnose heart disease, but for brevity's sake, I'm going to stop the video right now. I hope you enjoyed this and you found this useful and informative. Bye-bye for now.